Reproductive physiology, lactation, and menopause. All right, this is going to be a relatively quick video. Lactation, all you really need to know is that the main immunoglobulins that you're going to be seeing within the breast milk is going to be IgA, because IgA is for secretions. And then lastly, it's going to give pretty much all the nutrients that you need for the child, except for two things. It doesn't have vitamin D and it doesn't have iron, okay? So you're going to possibly need iron supplementation, but you for sure need vitamin D supplementation. I know they tried tricking us. I think I remember one question where they gave both vitamin D and iron supplementation. They're like, which one should you give the patient if they're exclusively breastfeeding? The answer is going to be vitamin D, because at times you can get iron, but you can never get vitamin D. So pick vitamin D if they ask you about that. Next is menopause. For menopause, and also, for the last thing, for lactation, lactation is essentially due to the fact that we have oxytocin and prolactin, right? Prolactin is going to produce the milk, whereas oxytocin is going to allow it to be excreted or secreted. Menopause is next. Once again, menopause is going to be diagnosed by amenorrhea for 12 months, all right? So if you have not had your period for 12 months, then that's the first diagnostic factor of menopause, right? And it's secondary to the fact that we have a decrease in estrogen production, right? And that's because we've lost all of our eggs. That's it. We've used up all of our eggs, because as we said, in female reproductive system, we are born with a set amount of eggs. Once we're done with those, then we have a decline in the number of follicles, ovarian follicles, to 0, and we essentially have no more eggs. They always in the vignette are going to say like a 50-year-old or 51-year-old, because the average age of onset of menopause is around like 51 years old, or like 50.5. But they will always say like 50 years old, 51 years old. So just keep that in the back of your mind when you're reading a vignette. Now, what they like to say about this is increase in FSH, like a severe increase in FSH is specific for menopause. And the reason behind that is because since you're no longer producing estrogen, you no longer have a feedback mechanism to stop FSH. Specifically, we know that estrogen is produced by, the final product is produced by granulosa cells. And we said that granulosa cells produce inhibin B in order to cause a negative feedback mechanism on FSH. Well, if granulosa cells are no longer kind of functioning because they are not producing our estrogens anymore, then they're no longer producing inhibin B. And so that leads to an overall sky-high rocket levels of FSH, because no more inhibin B there to allow for the negative feedback mechanism, all right? So that is specific for menopause, at very high levels of FSH. Now, the hormonal changes, right? So we have a decrease in estrogen, very high increase in FSH, as well as LH, and then an increase in GnRH, right? Because there's no more estrogen negative feedback mechanism. Now, the causes, the symptoms, we already discussed, but hot flashes is one of them, most common. Okay, atrophy of the vagina, the dryness of the vagina is very, very critical. It's something that they love to ask about. So make sure you understand it. Hot flashes, atrophy of the vagina. Osteoporosis was the second one that I talked about. All right, osteoporosis, because they have an increased risk of fractures, is very important, because estrogen normally increases bone density. Without estrogen, we have a decrease in overall bone density. Next is coronary artery disease. Well, what do we talk about? Well, without estrogen, we have increased levels of LDL, which is bad cholesterol, and we have decreased levels of HDL, which is good cholesterol. So without estrogen, we have an increased risk of myocardial infarction secondary to coronary artery disease because of these cholesterol changes. Very important, okay? Make sure you understand that. Now, menopause before the age of 40 suggests primary ovarian insufficiency, and so that's just premature ovarian failure, all right? There's relatively fewer questions on that, but make sure you understand the full aspect of menopause and its signs and symptoms. Important. That's all, and we're gonna move on to androgens for the next video.